Well, I'm on a personal quest. Between car accidents and being an athlete, kind of a klutzy athlete, I've hurt my knees, my hips, my back, I've got injuries all over the place, and I know what it's like to live in pain. So I'm on a mission to figure out, how can you be pain-free, or can you? Well, I gotta tell you, if you suffer and it affects your everyday life, you're gonna wanna stay tuned and listen to all of this, because my guest, Dr. Jill Howe, has something very exciting to share with us. Jill, I wanna welcome you to the show.
Thank you for having me.
And I gotta tell you, tell me about your mission.
Well, I'm on a mission to help people across the country understand the incredible capabilities that stem cells have. So right out of the gate, you have the ability to heal all those injuries and traumas that you've had, but here's the challenge.
Yeah?
Your body has less stem cells now than it did when you were born.
Really?
Now, there was a big controversy about what are stem cells. Is it cloned sheep? Is it Planned Parenthood? Is it involving something that's unethical or immoral? And that's not what we do at all. You wouldn't be involved in that, and as a medical professional, I'm not going to be involved in that either.
And I think that's so very important to set the record straight. So what is a stem cell?
Well, a stem cell is a cell that everything in your body stemmed from. It's what made you. It's what made your eyes, what made your hair, what made your knees, what made your fingers. It's everything in your body came from a stem cell.
Okay, and we have them in us at all times?
We have them in us at all times, but the highest potential for growing is when you're a baby. And so there are different places that you can get stem cells, but the place that we get them is from moms who consented and passed rigorous testing to donate their placenta after their baby is born via C-section.
Okay, so wait, just to set the record straight, because I'm very excited about this, but I want everyone to hear this. It's got nothing to do with the baby. It's the sac, because I gave birth to my twins, and that placenta we threw away.
Right, and that's what most people do. They throw away, but the doctors that work with our tissue bank have been educated about the fact that a placenta, from a healthy baby, could save other people's lives, could change other people's lives for the better.
And those cells, they don't not rejected by people. Anybody can get those cells.
Right. The cool thing is that the baby doesn't have an immune system. Before it's born, it doesn't have an immune system. So these cells can be given to anybody without any chance of rejection.
Okay, so when you're a baby, or when you're young, you've got a lot of stem cells.
You do. You have 1 in 10,000 cells in your body as a stem cell. Now, by the time you're a teenager, there's a 10-fold drop to 1 in 100,000 cells. By the time you're 60, it's 1 in 1,000,000 cells. By the time you're 80, 1 in 2,000,000 cells. So your ability to heal goes down dramatically as you age.
Well, you know, as I'm thinking about it, it's funny because a little infant has to grow a lot to become a toddler and a kid. So there must be a lot of those cells growing. And at some point, you and I will see each other 10 years, you'll look pretty much the same. So then maybe that's why you don't have as many of them.
Right, you don't have as many stem cells and your body can't, it's called on to repair from injuries and traumas and illnesses that you've had, and the more that you've experienced those, the less cells you have. It's kind of like a savings account. The more you spend, the less you have.
So I was talking about my kids, and you know, when they would get a cut, it would heal overnight. I thought that was miraculous. And then I realized, well, I don't heal as quickly. So you're telling me it's because we don't have as many stem cells as we age?
Exactly, and you need those to come to your rescue to help you repair when you've had injuries and traumas. And if you're healing slower than you were 5 years, 10 years ago, that just validates for you that your stem cell count is going down. And there's nothing you can do to just raise it back up on your own. You need an intervention like this.
Well, so up till now, if you're like, I have no cartilage really in my knee, you at some point when bone on bone, you're looking at a knee replacement, correct? That's the only option.
Well, that was the only option before. And people think that bone on bone means there's zero cartilage left. Well, there's some little fibers that are there that are sending out an SOS signal. And when this product is administered, there are proteins in the product that actually pick up that SOS signal and drive the cells to that area. So the body's saying, I need more cartilage. That's what the cells produce. My bone's wearing away, then that's what the cells produce. Or if it's your nerves, my nerves are dying, then that's what the cells produce. And it's amazing technology.
But you're telling me that you can just introduce this product into your body and it starts to regrow things that are missing?
Yes, where you put it. So if you have a shoulder problem and we inject in your knee, it's not going to regrow a new shoulder joint. However, if we put it in your knee, that's what it's going to do, is it's going to fix the cause of the problem. So it's not that you have pain, it's the reason why you have pain.
Right.
The cartilage is gone, the bone is degenerated, you're developing arthritis from that abnormal wear and tear now.
Wait a second. I've read things that say there's nothing you can do for arthritis.
Currently, there wasn't. So pills will take away some of the inflammation or help you with the pain. But again, that degeneration, it continues to occur until all that you're left with is the ability to get surgery, up until now. So this particular type of therapy, when it's injected into the area that's injured, will go in and regenerate that tissue that you're missing. So you can get new cartilage, you can get new knees, you can get new shoulders, new nerves.
Do you know how many people this will help?
I do, and that's why I'm on a mission is to get the word out there, because I think that's why so many people aren't aware of what it is, including maybe some doctors, because there's not enough information.
So one of the things that you do, the mission that you're on, is you tour around the country as well as a whole group of doctors, and they're called the Stem Cell Institute of America.
Yes.
What is that?
Well, there are 150 of us. We're an army, and we're going out there and delivering seminars, multiple seminars every single day across the country to educate people. It's completely free. We invite you to come to a free seminar, and we'll educate you about what your options are, including stem cell therapy and other advanced options. Or what do you get with surgery? What happens if you don't do anything? And then we'll invite you in and talk to you more in the seminar about whatever questions you might have about your health.
So I just have to ask you, if you've got pain anywhere, if you're suffering in your joints, your ankles, your knees, your hips, your neck, your lower back, and now if you've got arthritis or neuropathy, there's so many treatment options, but if you don't know about this, you need to check out the seminars that Jill's talking about with the Stem Cell Institute of America. They're completely free, right?
Completely free.
So now you have no excuse to
right.
just go get educated to find out what your options are.
Right, you have nothing to lose. Here's one guarantee I can make, because you can't make guarantees in medicine, but one guarantee I can make is if you don't do anything about your health problem, it will get worse.
Oh, that's so true.
And you'll limit your options. The worse it gets, the more you limit your options. People come in, and this is a one treatment protocol. One injection in your knee.
Whoa. Nothing's just one treatment.
This is one, that's how powerful it is. It's one injection, and the cells start to go to work and regenerate and heal and repair the areas that have been injured or damaged. And from there, then we look at the rest of your body to see. So once we heal, if you have a degenerated knee,
right,
it's going to affect your hip, it's going to affect your back, it's going to affect your neck, it's going to affect your ankle. So people come in and they say, it's just my one knee. But we don't stop there. We want to evaluate you as a person and find out, because we don't want you to come in 3-4 months down the road and go, now my other knee or now my back. So we evaluate you as the person. So you come to the seminar, you get the information, you learn about how the body works and how stem cell therapy and other advanced options could help you. And then if you come in and you get the consultation, then you'll know the most about your own body and what's recommended, and then you can decide.
So is this therapy right for everybody?
It's not right for everybody. I would love it to be the answer for everything, but it's not right for everybody. But I'll tell you what, the people that it's right for, oh my gosh, like Jerry, who had 30 years of back pain, couldn't even dry off after he got out of the shower, had tried everything from doctors to shots to surgery. Now he's feeling great. He's walking around, he's gonna start playing golf again, and he got his life back.
Just from a treatment?
Just from one treatment. It's incredible.
Okay, so I love the fact that this sounds too good to be true. So, and if you're thinking that and you're skeptical, yay for you, because that's why they're doing seminars. So people can come and get educated, learn about this for themselves, and make very smart decisions.
That's right, because otherwise, what are your options? Your doctor may or may not know about it. They can't be an expert in everything.
Right.
You can look on the internet, but we all know that that could lead to some big problems.
Right.
Or you could come and find out firsthand what your options are. Now, we don't just talk about what we do. We'll educate you about the different types of stem cells and what other advanced options are available.
Would you recommend that somebody tells their doctor about this and says, hey, you need to, if you don't know about it, maybe you should check this out?
Well, we tell people that once they're done with our seminar, they'll know more than their own doctor about stem cell therapy, unless their doctor does what we do. And so they bring it to them oftentimes, and the doctor will say, you know what, I've done a little research on it, and I found that people are getting great results. Or maybe they don't know anything about it, and then that spurs them on to start learning themselves.
So what kind of conditions have you seen the best results in?
Wow, knees are fantastic. People get amazing results there. Neck pain, back pain, degenerative hips. If you look at having a hip replacement, that's a long road to heal. And there's no guarantees in any type of medicine, but to get a stem cell therapy treatment in your hips, I personally have seen it. My parents, my sister, my husband, our patients that have thought, I don't want to have surgery, or I can't have surgery for whatever reason, are coming out on the other side, walking without canes and walkers anymore.
All right, so let's say surgery is an option. Your doctor says, this is what you need. Should you still get stem cell therapy?
If you're a candidate for it, I would recommend doing the stem cell therapy first. Build up as much of that joint as you can, and then if you still need surgery, you can do that. But once you have surgery, that can't be undone. Once you have the stem cell treatment, your body's just going to grow and repair what should be there.
Well, so throughout the show, we're going to meet a bunch of doctors, because I'm going to do our research so everybody listening gets as much prepared as they can.
Absolutely.
Because I'm so excited and blown away by the fact that this even exists.
I am as well, because I've been in practice 26 years, and for the last 2.5 years, we've been utilizing this particular type of treatment. And I had a very physically aggressive practice. I put a lot of myself into my patients. I did a lot of work on them.
Right.
And I could get a lot of people better, probably 95% of the people. But there were some people that no matter what I did, I just couldn't get them to the point that they needed and that I wanted them to be at. And this gives us a much more predictable way to help people, and it's a long-term treatment.
Well, I also know personally from my experience how bad pain can be. When my knee hurt, it was a good 1.5 years after I tore it, that I was just miserable. My life changed. I didn't want to do things. I didn't want to I didn't do anything. Actually, my career fell apart for a good 1.5 years.
Oh my goodness.
I know. And then I watched my dad, who had severe back pain, and he was a laborer. You know, if he wasn't working, he wasn't making money. And sometimes he'd be flat out on his back. So I know what pain does to people firsthand. It makes you miserable. It shuts you down. You don't want to do anything. And sometimes you don't even know if you want to keep going.
I've had many patients tell us that. They said, you know what, if this doesn't work, I really don't know what I'm going to do. I've looked at other options, like I don't want to be here anymore. And that breaks my heart to think that as a community in medicine that we failed this patient.
Right.
And to give them hope, and not only hope, but to give them results is they just want to go out and shout it from the rooftops and tell everybody that they know about it, because they don't want anyone else to suffer like they've been suffering.
Well, you know, it's funny because, you know, in science class, you'd see that salamanders actually grew back like tails and arms and legs, and you wonder, why couldn't we do that? Is that what we're on the cutting edge of doing in terms of rebuilding our bodies naturally?
I think so. I think it's an incredible technology that has many applications across the world. Stem cell therapy treatment is being used to help people with type 1 diabetes regrow the part of their pancreas that doesn't work, that causes them to rely on medication to live a healthy life or to live their best life. But to be able to have somebody come in and say, you know what, you're not so bad yet, you don't need surgery. Why don't you try this intervention and see how much improvement you can get in your knee, and keep them from having to have something like a surgery.
Well, let me ask you a question. So we've got a lot of young athletes who do things. I mean, I hurt myself when I was a kid initially in karate class. Can anyone at any age get this therapy?
It really depends on what their problem is. In a child, certainly they have a lot higher count of stem cells, so they have a much faster, like you mentioned, much faster ability to heal a problem. But depending on the severity of the problem, it may be something that a doctor chooses to use on somebody who's younger. We've delivered this care to someone that's 93 that thought, I can't get any better than
That's
I am.
awesome.
And they had had 9 knee surgeries, and we were still able to deliver it not into the joint because that was synthetic, but into the muscles in and around the joint. And this person just wanted to be able to dance with their girlfriend.
I think that is so exciting. Let me ask you another question. Do you guys take insurance?
Well, we take insurance in our clinic. Now, this particular type of care, what I ask people is, you know, you're in pain. Like you said, you're in pain. You're losing sleep. You can't do the things that you like. We had a gentleman that said, I just want to be able to rock my grandbaby, and I can't because my knees are so bad. Or I just want to spend time with my wife, or I want to travel with my kids. And I ask him, how much is that worth to you to be able to do that? I mean, ultimately, we're responsible for our health.
I agree.
Not insurance, not our spouse, not our work. It's us. We're the only one in this body who knows what it feels like. And I ask people, do you think it would be worth it to do it? And when they look at it like that and they realize, I don't want to put my health in somebody else's hands, I should make the decision, then most of the time they do.
Well, I have to tell you, it is an affordable solution. I mean, I've spent time in the hospital, and I'll tell you what, those bills are outrageous. This is very, very affordable. And like you said, when you're in pain, if you've ever uttered those words, oh, I'd give anything to not be in pain, this is the anything.
It is the anything, because we do have ways to make it affordable for everybody. And it is something that was never available until now. And to have the ability to put surgery on the back burner, you can always go have surgery.
Right.
But you can't always regenerate your knee or your shoulder, or be able to dry off after you take a shower like Jerry did, or go skiing like an 83-year-old patient that we did a back treatment on.
Oh, I would love to go skiing again. I stopped because my knee hurts too bad, and my kids are just getting into it. I'm like, I don't know what to do. So I'm going, is this right for me?
Let's find out.
I know. I've already scheduled my consultation,
Very
and I am
good.
so there. So Jill, not all stem cells are created equal. In fact, I understand there's 3 different types that you can get.
Yes, there are. We could take them from your own body, which would be from your hip, where they drill into your hip, and that's
Ew.
a surgery. It is. It's painful, and some people say I have more pain there than I did in my knees, where I actually needed the stem cells.
But also, you're also getting older stem cells, so how is that beneficial?
That's right. You may have to have that surgery repeated in order to get enough of the quantity or quality that you need.
Okay, so that's one.
Well, adult has two different options. You could take it from your hip, or you could take it from your belly fat. Now, a lot of people think that sounds great, because I'll get all sculpted and I'll look great, but they only take about a quarter pound of fat. So
Yeah, not
you're all
worth it.
bruised and achy, and yes. And then once that's done and they get the cells, and they re-inject them back into your body.
Okay.
So that's one type. The other type is embryonic, where they're taken from a baby. Now, that's unethical and immoral, and we don't do that in our clinic. We wouldn't associate that with that, just like you wouldn't.
Well, and I think that's illegal, and that's what we used to hear about.
Exactly.
But then there's the type that really does work and is completely amazing.
Right, and that's the amniotic stem cells.
Okay.
So we work with a company, and they're part of the American Association of Tissue Banks. They have 3 hospitals within 10 minutes of them. So they've educated the doctors about educating their patients and screening their patients, so the women that are pregnant know what their options are. Throw the placenta away, or use your placenta to do good and help other people.
I think it's just amazing. I didn't even know that was an option.
It's incredible, and people ask me all the time at the seminars, "Oh, I just had a grandbaby. Can I use that?" And most of the time, what they're talking about is the cord blood that's been saved. And
Right.
unfortunately, that can only be used for that baby. But the cool thing about these cells is they can be used for anybody, because the cells don't have an immune system, so there's no chance of reaction. There have been over 300,000 treatments done with this particular product with not one reaction.
I'm sorry, you need to say that again, because everything has a side effect, doesn't it?
Well, apparently not.
So you're saying 300,000
injections, 0 negative reactions.
Okay, have I taken away all of your doubts right now? You don't even need to listen any longer. The number that you need to call is on your screen. And I'm serious. This is something, as I'm hearing it, if you're in pain at all, you have to get to a seminar.
You owe it to yourself to at least come and hear about it, and then when you learn the facts, you're going to want to do it. You're going to want to come in and find out whether or not it's right for you. And if it is, we'll tell you. And many people can get treatment the same day that they come in for their consultation. You see this switch flip in their head, and they go, "I want that. I'm tired of being in pain. I don't want to rely on drugs anymore. And you know what? I've missed enough of my life. This is the day that I take control and I put myself at the front of the line." And they do, and they're so happy.
So, I've been interviewing a lot of people about this because I love doing my research, and it's my responsibility as somebody who's on television to bring and do the best research I can for everybody listening.
Right.
So I met Jerry, your patient.
Really?
He sat here and he said it not only his life better, but his wife and his marriage and his kids and his grandkids. He said that his pain was like a 9.5, 10, and now it's like a 1.
I can't even imagine living with pain. 30 years he lived with this pain, and he's really an ambassador. Out where he lives, we do these workshops out there frequently, and he's starting to become a celebrity out there. "Oh, I know Jerry. I talked to him. I saw his wife." And they go out and they talk to everybody they know about this. They don't want anyone else to suffer like Jerry did.
I think it's one of the most miraculous things that I have ever been a part of.
It warms my heart when I hear people's after stories. In fact, some of the people that come in, I say, "Isn't it great to be an after and be the person that's out living their life?" At the workshop, I always ask, "What are you going to do when you don't have this pain anymore?" And the things people talk about is everything from, "I just want to walk around and do what I normally do," to "I want to go back to work," and then this 83-year-old gentleman who wants to go skiing. You see them light up and come alive again when they're really thinking about, "Oh my gosh, if I didn't have this problem, this is what I do." And that's what we want to make their dreams come true.
Now, we do have to be very, very clear that it is not for everybody. And as much as I would like to say it's a perfect answer to everything, it can't be. There are people that it may not be right for, but you take the time and you screen people. And what we're talking about here is really getting yourself to the seminar to listen for an hour so that you can make your own decision, correct?
That's right. And once you come to the seminar, when you decide to come in for the consultation, we will sit knee to knee with you just like this.
Right.
And find out from you personally what's been going on. How did you get in this shape? What have you tried so far? What worked and what didn't work? And then we'll do an exam. And that's where we really help you, the person, understand. It's really easy to say my knees are bone on bone, but when you see an x-ray, I've had people come to tears because they say, "Oh my gosh, that's what I'm walking around on." Or show their husband, "See, honey, I told you something was wrong with my neck. Look at it."
Right.
And once they see it, there's nothing that can stop them from getting the care they understand that they need. And it makes my day when that connection happens and I know it's over. They don't have to deal with this anymore.
All right, so we're almost coming to the end of the interview. Is there anything you'd like to add?
I just would encourage people, don't suffer anymore. You don't have, there's options out there where there weren't options before that don't mean taking medicine for the rest of your life. You might not have to have surgery. This could be an option that gives you your life back, that thing that we all need and want. We're not going to waste your time. If you come in and we can't help you, we'll tell you. But there's nothing in your life that's more important than your health. I've had people say, like you said, I would give anything to get my health back. And it's even more heartwarming when you see a spouse say, I've done everything. I've been on this journey with my wife and no one's been able to help her. And then see her get the help and see, it makes me tingly just talking about it and see them really enjoy their time together. You know, they work so hard to retire. We all do. And you don't work that hard to spend the rest of your life in a wheelchair or confined to your home or in pain all the time. And to really see people's lives literally change is the reason that I do this every day when I go out and educate people. And I'm not going to stop because it's the thing I'm most passionate about.
So, Jill, there's a number on our screen where people can come in for a consultation. They can come right directly to a clinic. And what will they find out?
Well, there's 4 reasons that people should come in and actually do it. Because number 1 is we all know that their problem is going to get worse if they don't do anything about it. Number 2 is if we can help them, they're going to feel great. They're going to feel healthy and happy and vibrant again. And number 3, we're not going to waste their time or money. So no matter where they go across the country, when they come in and they get the consultation, if the doctors feel that they can't help them, they're going to tell them. And then they're going to help them find something else that might be able to help them.
Well, and you guys do that because you're part of an institute. It's called the Stem Cell Institute of America. You really are out there as a group of doctors committed to getting people better.
Absolutely. We're a united front. So I've sent people to other doctors in other states and vice versa.
Okay.
We just have the patients, the community, the country's best interest at heart, even ultimately, hopefully, the world. But the 4th reason, the most important reason to actually go in and do this consultation is there's nothing more important than your health. I mean, we meet people towards the end of their life and they say, oh my gosh, I've wasted so much time. I didn't know anything else was out there. And think of all the things I missed out on, playing with my grandkids and going on vacations and just enjoying myself, just doing everyday things without pain. And so you can get a new house, you can get a new car, but you can't get a new body and you can't take it with you. You know, why not feel great now? And that's really what life is all about. And that's really our main focus, is to find out whether or not we can help you get your life back.
Now, are the consultations offered free?
The consultations are free. And then from there, if you need an exam, we'll let you know if there's any fees that accompany it. And we're very upfront. It will tell you before we do anything so that you can decide for you if you feel like it's better for you to remain in pain, or if you feel like this particular option is the one that would help you accomplish your goals, get out of pain, feel healthy, enjoy your life again.
You know, Jill, I'm all about education. And you can go on the internet, but you never quite know if what you're hearing is real or who puts it up there. Your seminars are taught by accredited doctors who do the therapies, who understand, who are part of the Institute, correct?
Correct.
The Stem Cell Institute of America. They're all part of this.
Yes, and they've all been trained and they've all been educated, and that is our goal, is to go out and educate people. We have 3 different goals. Number 1 is we want to educate people so that you can make a decision to get out of pain.
Right.
And we want to help you maintain that improvement that you get and get your life back. Those are really our 3 goals. And don't decide for yourself. Come and listen to factual information and get an opportunity to ask any questions that you have. Don't walk away with that, well, what if question in the back of your head. Bring it up, ask the question, get the answers, find out.
Okay, well, because I'm in the same boat as everybody else out there. I am sitting here listening to you. I have not had it done yet, and I'm thinking, I'm in pain every day. My knee clicks. Every time I sit down for too long, I get up from the movies or playing with my kids, and it hurts. And there's things I don't want to do, and I don't want to wear high heels. And in my profession, that's debilitating. So are you like me and go, so the first thing I'm going to do is go listen to the seminar.
Right.
I'm going to, and it's free.
Right, completely
Why
free.
wouldn't you do this?
That's the question I ask myself every day. Because you get an opportunity to find out, is this right for me?
Right.
What is it? That's what people's biggest question is. What
is it?
It seems too good to be true. And we all know when it seems too good to be true, it must be. But really, truly, when you learn the science behind it, you can make your most informed decision. Because that's why people go on the internet. They want to get the information. They want to become informed. And really, you're responsible for your health. And I'm responsible for my health. So we don't want to put our health in someone else's hands. Now, doctors certainly are very well educated. But this is something you can do above and beyond that to maybe bring them some information so that they can find out the best way to help you as well.
So what would you recommend people do first?
I would recommend that they call and sign up for the seminar and get their rear end in the seat and listen to the information. And then from there, they can decide, you know what, this makes perfect sense. I'm going to come in and get a consultation. Again, free. You have nothing to lose.
Right. And I don't know many things in life that are free, but finding out about how to take care of your health, I love the fact that I don't have to go to medical school.
Absolutely. We already did that for you. So we'll share the information. We'll share all our research. We'll share our results with you. And we even have patient testimonials in the workshop. So you can see in black and white an x-ray of people's knees before and after treatment. You can see the miracles happening right there on the screen.
Well, I'm just so jazzed by you, your commitment, and everything that they're doing. So I want to thank you so very much for sharing this.